Thank you, sweetheart. All right, y'all. Before we land, as you already know, we already got to talk a little bit about this. We got to vote on the Affordable Care Act and think if we're going to expand Medicaid. As you know, Kansas has about 14% of our constituents uninsured, and the majority of our folks are dying from cancer and heart disease. Within our uninsured, the majority of the folks who are uninsured are ranging from 19 years old to 34 years old. Ugh. Well, we have to decide whether we want to expand Medicaid or not, so let's go with the obvious first. Representative Nick, what do you have to say?
All right, only the obvious, Robert. Let me make it clear. I think we need to stick together and do everything we can to make sure that we don't damage the integrity of our healthcare system. People who are in the workforce and already paying for insurance will have to pay higher premiums because insurance companies will now have to cover a wider range of benefits and insure people with pre-existing conditions. Also, if people don't sign up for insurance, they'll be fined. No one should be forced to purchase insurance. This is America. Taxes will have to be raised to help pay for this expansion, including taxes on medical devices, making medical expenses that much more expensive. By forcing businesses to offer full-time employees insurance, this will lead to a loss of full-time jobs or employee firing. Also, an increase in insurance will cost middle-class people who don't qualify for Medicaid to be priced out. Forcing insurance companies to insure everyone can lead to the destruction of these companies and major loss of jobs. Plus, the plan's deductibles will be way too high for the people this Affordable Care Act is supposedly helping.
Excuse me, ma'am, do you want peanuts?
Oh, yes, thank you.
And here's your champagne.
Oh, thank you so much. Can I just say something?
Who let the one Dem in the conversation?
I would rather die before being a Democrat. Anyways, think about it. If these people have insurance and can get treatment when they're sick, they'll be able to get back to work sooner and keep the money flowing in. They'll probably live longer too, so we'll get more labor out of them.
Thank you. I don't know. I'm worried about the potential consequences that ECA and expanding Medicaid may have for our healthcare system, especially in our great state of Kansas. While the intentions are noble to provide healthcare access for all Americans, I believe this legislation may have unintended consequences that could harm our healthcare system and the good people of Kansas. We have a stable healthcare system that people can trust and get consistent, fast, and accessible care. Starting health insurance marketplaces will cause uncertainty, distress for people, and it's going to leave many critically sick people without care for a period of time. Also, we've long had the necessary financial backing from insurance companies and pharmaceutical companies to support our campaigns. They're our friends. Passing the ACA would clearly cause them to lose millions and thus harm our alliances with them as well. I don't know about y'all, but I want to get elected again next year.
Well, a lobbyist from Purdue Pharma gave me a call last night and said that he would make it worth our while to push this thing through because his client serves to benefit from having more people to Medicaid. He also said Purdue would make a hefty campaign donation to each of us if we made sure more people are insured and using prescription pills. They have a new drug called OxyContin that gets people hooked quickly and has been making them a fortune. So the more users, the better.
Girl, you are just evil. I love it. Who was your point person? Rep Morgan, last time we talked, you had some great points.
Thank you for finally asking me for my opinion. Many Americans oppose the ACA because they do not trust their government and they oppose the government role in healthcare. Let's build off this distrust by flooding the advertisements with more negative connotations on the expansion of the ACA as a scare tactic. Maybe throw in the risk of the government turning into Big Brother to really scare them. We don't want to risk losing those that are devoted to our party. We can blur the lines between opinion and fact, making it harder for people to discern the truth and credibility of scientific experts and governmental institutions. Let's face it, the closer we get to a pure laissez-faire capitalist society, we just continue to get richer. The less they know, the better. Hopefully we land soon though. I am supposed to catch another flight to Cancun.
If you don't mind, I've been overhearing what y'all have been saying, and I'm interested in your discussion on Medicaid. Healthcare is the main reason why I'm voting in this upcoming election. I've been experiencing difficulties paying for my health insurance. I was so confused as to why, and I finally decided to call my health insurance, and they told me it's because of my pre-existing condition. I have type 1 diabetes. Since I am likely to cost the insurer more in claims expenses on top of my expensive premium, I still have to pay for out-of-pocket expenses. It's ridiculous. Anyway, I hope with the new proposals for Medicaid expansion that it gets passed in Kansas so it can protect people like me from discrimination and offer me better options for health insurance. I was looking into it, and some of the Medicaid expansion proposals seem like a huge step for women's health policy. I heard it might even expand healthcare coverage for basic preventative health services and healthcare coverage for abortion.
Oh, sweetheart, I think I asked for still.
Ugh.
Don't listen to her about that woke, liberal, pro-choice BS. Obama already agreed to change the language of the bill so it bans federal funding for abortion and promises states will get to decide if their health exchanges cover them. It'll make our conservative constituents happy, and remember, the more forced births, the more our workforce will grow. I can still have an abortion, of course, if I want, but all those people who are on Medicaid probably won't be able to afford one. The larger the working class, the better. All signs point to this working in my best interest. Money, increased labor force, and guaranteed funding for re-election. I want to vote yes on Medicaid expansion, even if you guys vote no.
Well, just because they cut you a pretty penny doesn't mean we get the same too. And I think that we do not have to pass this thing or expand Medicaid. We're all just trying to get reelected, and to be quite honest, I'm a firm believer in the Constitution. And nowhere does it say that we have to provide health care to our citizens. Nor should the federal government tell us what to do with our own state money. As Republicans, our number one priority is not to vote for anything the Democrats want. So let's just get this over with. Yay for expanding Medicaid and nay for no expansion.
Nay.
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 Nye.
Great, no Medicaid expansion for Kansas. We didn't even need to have this conversation.
Okay, sorry.
No.
Oh my god, I spaced out because I went off script.
Breath by breath.
Not be laughing.